Hello, fellow humans. We can't ignore the elephant in the room when we're thinking about public health. Because humans, we're facing existential crises, where our very existence is at peril, where the future of humans not yet born is uncertain. And this is because of environmental crises, multiple environmental crises. Healthy Hospitals is about helping hospitals to improve their environmental impact so that hospitals can actually be part of the solution. We all need to be part of the solution, and it's never been more urgent. Our lives really do depend on it. Now, health professionals, oops, going the wrong way. Oh, my clicker is not working. Okay, we got it. Okay, my apologies. Okay, so health professionals, okay, apologies. So health professionals take a solemn oath, and that is to do no harm. Now, shouldn't hospitals strive to do no harm as well? Shouldn't hospitals look at the impact, the environmental impact of running a hospital and see how they can improve that? But do they even know what that impact is? Are they measuring it? How can we help them improve? As a scientist, I know this is really important. As someone who studied law, I know that we have a human right to an inhabitable earth, and that future generations do too. Now, the big issues that we must deal with are global warming. We've been warned. Scientists have been raising the alarm bells. We're also in the midst of the 6th mass extinction. We are losing species at a rapid rate, 1,000 times the background rate. And humans are connected to the web of life through time and space. If we lose biodiversity, we risk ecosystem collapse. This is devastating. Now, The Lancet, the prestigious medical journal, says that we must make protecting biodiversity the important planetary health issue of our time. So, we went about looking at how we might do this in the context of helping hospitals. And it's great to say that there's a massive opportunity because we identified hundreds of ways in which hospitals can improve to reduce the negative impact that they have on the environment, whether through energy, resources, sure. So we had a look and we found, sorry, my clicking is really havoc today. We found that, look, hospitals actually contribute 7% of the carbon dioxide, hospitals and healthcare in Australia, which is obviously significant in global warming. They're also resource intensive, they have a lot of waste, they had a lot of plastics that are discarded, non-renewable energy and inefficiency. So this is a great opportunity for improvement. Buildings, food, transport. We can address these 3 big things with hospitals. So buildings are pretty bad when it comes to the environmental impact with energy consumption, but hospitals are double, the normal office. So great opportunity to improve. And I'll hand it over to my colleague who will share more, and hopefully with better luck with the clicker.
Awesome, thanks. So this is the system that we kind of outlined. So in the middle, you've got a hospital. It takes in sick or injured people, and it outputs, fairly healthy people. That's what their job is, right? But in the process of doing that, they produce a lot of things like carbon dioxide through the energy they use, and a lot of waste products, such as latex gloves and whatnot. Thing is that a poor environment results in sick people, so it's kind of like a feedback loop. Our sort of objective is to try to reduce the effect of this feedback loop. So, what we propose is the development of an accreditation scheme and toolkit to help hospitals reduce their waste. So, here's an example of, like, we want to provide them with data on how they're performing regarding to this issue, and we want, like, this is an example of the accreditation scheme where we will rank them, and they can more or less compete to be more environmentally sustainable. That's it. Our call to action is for $500,000 for research and development.
Thank you for that, and having been in the position of trying to develop a healthy hospital and understanding the impact that hospitals have, this is a really important issue, and you've definitely, it's definitely something that needs to be looked at. The sorts of responses that I've had in the past in this area are things along the lines of, it costs too much to respond with the sorts of solutions. We don't have time, we're too busy, everything that you're offering is going to take more time and actually detract from patient care. Did you talk about those issues and how you might tackle those sorts of objections and responses?
Yeah, so we looked at, actually, a whole range of solutions and how we might make it as attractive and as easy as possible. So first of all, making it visible to be able to measure and find out what's going on. And then there'll be the low-hanging fruit where we can actually save costs, save money, and then that can feed into the loop of financing more and more solutions. So basically hospitals can be running on better energy, they can be more efficient, and just saving energy, for example, will provide more funds to feed into other solutions. With the certification trademark, that's, I guess, a measure, an external measure that will rank the hospitals. So it gives us, the public, and people that are really concerned about the performance of hospitals, some way of knowing who's doing well, who's doing not. And then with our system, we can actually mine big data to see who's doing well, why they're doing well, and then recommend improvements for others. So if you help with the financial side of things, but then there'll be other benefits as well. But it certainly has health benefits, because we know that the health of the environment actually impacts the health of humans. And look, if there's severe heat, we'll have more heart attacks and people flooding emergency. So it is in the hospital's interest as well as our wider interest. And then I think regulations will change. Technologies, including Internet of Things, are there. We'll be able to link things much better. Even things like telehealth. Just minimising transportation, unnecessary visits, unnecessary revisits. There's a whole range of things, so it's just a mind-boggling opportunity, which is why we had a very messy diagram, and we just came up with, we need to help them measure, because there are so many ways, and a certification mark is a really good thing to strive for, and then show off. And we heard that hospitals are a bit competitive, so, someone that's doing really well might encourage the next one to do really well, and, and then people can just, go up the ranking, and so the hospitals can go up the ranking. So we're going to move on. Thank you.